fooled by clever names and pitches, pick up my certified natural toothpaste. It's so naturally natural that its naturalness has a natural certification. It's that natural.
Hey, this does pretty good.
Good afternoon, everybody. My name is Nigel Maynard. I'm the editorial director of Drugstore News. And welcome back to our ongoing series where we interview thought leaders in the retail pharmacy space. Our guest today is Warren Moore. He's the Vice President of Health and Wellness at Walmart. Warren, good afternoon. How are you?
Nigel, I'm doing good. How are you?
I'm good. Thank you for joining us. We really appreciate it. Before we get started on some of the other questions that we have for you, can you tell us briefly about health and wellness under the Walmart brand and how it's been progressing over the years?
Sure, Nigel. So many know Walmart as a retailer, but we have a strong history when it comes to health and wellness services. We started our mission back in 1978, so we've been in the pharmacy business for 43 years, and we've done things from the launch of $4 generics to our now having Walmart Health Centers. We operate vision centers under both the Walmart and Sam's Club brand, and we stay core to our mission of what our company is. We want to save people money so they can live better, live healthier lives, and we've been doing that for quite some time now.
Mm-hmm. Now, Walmart is making waves in the diabetes space with the first ever private brand analog insulin, which is Relion Novolog insulin. How will this initiative improve the health of communities, and how will it help to reduce disparities in health?
Well, Nigel, as we talked about, we know that, when it comes to health equity, that your social and economic status accounts for up to 40% of your health outcomes. So again, going back to that save money, live better. So therefore, we know that the cost of services become a barrier to many to achieving their full health potential. And so at Walmart, advancing health equity has been and is central to our mission. We recognize just how important it is for all customers to have access to quality, affordable, accessible health resources. And this is especially true for people who live with diabetes, who often struggle with managing the financial burden of the disease state. It is said by the American Diabetes Association that it costs annually about $9,600 for one to manage their diabetes condition. And so for the more than 3 million customers who choose us each and every month and shop at Walmart, who live with diabetes, we're proud to now have Relion Novolog insulin that we can offer to these customers at a significant price savings without compromising insulin quality. Mm-hmm. And, Relion Novolog is the first and only private brand analog insulin on the market. And our efforts to bring this to market really will save our customers from 58% off a vial of branded insulin and 75% off a box of flex pens. And so simply put, we know that price point will revolutionize the accessibility and affordability of insulin and make it easier for our customers with diabetes to get the care and manage their chronic condition.
So will it be available at Walmart or at Walmart and Sam's Club?
It's available at both Walmart and Sam's Club.
Okay. So what other initiatives and programs is Walmart putting in place to deliver care to the communities and increase quality and affordable healthcare resources?
Yeah, between Walmart and Sam's Club, we operate over 5,000 pharmacies nationwide. And 4,000 of those pharmacies actually sit in what is defined as medically underserved areas by HRSA. And in these communities, we know a large portion of the population don't have adequate access to healthcare, but they do have access to Walmart and Sam's Club pharmacy, as well as our pharmacists who are part of the community that can speak to the needs of the local community. And so when it comes to conditions like diabetes, we're so proud, again, that customers choose us as their destination for their resources and care. And with 150 million people passing through our doors each and every week, we're in a unique position to meet people and reach people where they already shop for their groceries and their household essentials. And that's why it's important for us to put products in the hands of our teams and tools in the hands of our pharmacists and clinicians like Rely on Overlaw so that they can meet the needs of those they serve. And, Nigel, we talked about in the opening, right? We've been at this for 43 years. We've launched $4 generics over 15 years ago. And so we're not new to this, but we continue to find ways to innovate and bring new access for our communities. We have our Walmart health centers that I mentioned, and they provide access to care with transparent pricing for key services like annual checkups and dental exams, regardless of one's insurance. We recently acquired MeMD, which will allow our Walmart health clinics to provide virtual care, both acute and chronic, and along with behavioral services. And so that will complement our in-store as well as, with our online offerings. And then we've hosted Walmart Wellness Days since 2014. But we've done over 4.8 million screenings that are free screenings around things like diabetes, cholesterol, and hypertension. And then we never leave out our associate base, our most valuable resource. And so all of our associates, both full-time and part-time, have affordable healthcare options that include no lifetime maximum and 100% coverage of certain eligible preventative care. So this is just a quick snapshot of the healthcare offerings that we have, and we'll continue to innovate and make healthcare better for all who interact with our company and our brand.
Right. Okay, great. So how has the pandemic influenced Walmart to address social determinants of health and just overall?
Yeah, the pandemic, exposed the magnitude of the health inequities here in the U.S. And many of those inequities we know exist in the Black and Brown community. And while these aren't new issues to our country, it did bring it to the forefront for the American people to understand the need for us to consider just where people are born, they work, they live, they play, and they pray, and how that affects their health and really affects their life. And we've seen firsthand in this country that your zip code is more important than your genetic code when it comes to your health. And for that reason, we know that healthcare should continue to be very local and one neighborhood at a time. And that was reinforced here by the pandemic. I would say throughout the pandemic, we've learned as a company and strengthened our efforts around how we address inequities in ways that will serve to guide us as we bring forth those new solutions we talked about for future needs of our medically underserved areas. We were among the first, Nigel, to stand up testing in our parking lots. We also leveraged our drive-thrus and our pharmacy to do testing. And so when we had that data, and then when vaccines became available, we knew that it showed that our Black and African-American communities, our Latinx communities, and our diverse populations were at greater risk of dying. And we also found that there was a greater risk of vaccines potentially not getting into arms in these communities. And people wanted to talk all about that it was hesitancy, but we know that risk stemmed from things like lack of transportation, lack of ability to sign up online because of broadband gaps, that we know that there were mistrusts and myths about the vaccine. And so when we think about social determinants of health, we deployed communication that were both in English and in Spanish. We partnered with trusted voices like pastors and physicians from the Black community. We partner with institutions like UNIDOS and NAACP in order to get culturally relevant content so we can get shots in arms. And so we then, as a company, took our clinics, we did what we call mass vaccination clinics within neighborhoods to get the vaccines in the neighborhoods. And we left appointments open in our stores for people who couldn't get online. And so that type of learning and that type of knowledge, we're looking forward. As we look forward, we're committed to taking those same type of actions to help prevent poor health. And I would say on this topic, I would say things like food insecurity. Let's take that as an example. When food insecurity is present, when a person doesn't have enough food, we know that leads to poor nutrition. And when I have poor nutrition, it gives rise to these chronic diseases like diabetes, cardiovascular disease, and hypertension, and even delays in kids. And so we know that if we can reach people earlier in their health journey, if we can focus on preventative health, yet still improve the quality of health care and reduce the cost to access their care, we know that we can achieve better outcomes. And so these are the areas we'll continue to focus on at Walmart. in the future, and doing so with local communities in mind, doing so with the customer, the patient at the center of everything that we do.
Great. Well, Warren, appreciate it. Thank you very much for joining us today.
Thanks, Nigel. It was a pleasure to be with you.